Hello everyone, welcome back to my channel and welcome to another video. So this video I'm going to explain how mental health nursing is different from India or any other country, and what are the services available and what are the opportunities in mental health nursing. So if you are interested, please keep watching. Also, those who are new to my video, my name is Jaya Singh and I'm working as a mental health RN in UK, and I make videos related to information and updates on nursing and mental health nursing in UK. So if you are interested, please subscribe to my channel and keep watching. So let's not waste the time and get into the video. As I've mentioned today in today's video, I'm going to explain about how mental health nursing is different from India or any other country. And so to make that easy, I've divided this video into two parts: clinical skills and practice. So first we're going to discuss about the practice. So let's start. So as most of you are aware, so the regulatory framework for nursing in UK is NMC. NMC sets all the standards and all the education and training and practice in place, and they also make sure that there is a uniform code of conduct for nursing all across UK. Whereas in India, if you see, there is INC and there are state councils, so it differs across regions, and also there is not a standard practice for nursing in India. So that's the one difference I've seen in terms of regulatory framework. Another one in terms of practice is education and training. So if you have seen in India, people do, like myself, I've done general nursing, and in that I have done like 2 or 3 months of my placement in mental health nursing. So I haven't done any specialization, or I'm not a master's in mental health nursing. So I have no specialization in mental health nursing. All I have done is 2 or 3 months of placement in mental health nursing, and then I've taken experience for 2.5 years in psychiatric ward. But if you see, mental health nursing in UK, like the students, they do a separate course in mental health nursing. So people who are interested in going into psychiatric nursing, they have to do mental health nursing. So they don't do general nursing. So they don't know anything about general nursing. I think that's a positive point for people who are coming from India as well, because they have both knowledge, physical health and mental health, because they have done a general nursing. So sometimes I feel upper hand when I work in mental health nursing, because I know a lot of things about physical health as well. That just give me a plus point. Point is work environment. So in UK, if you are a mental health nurse, you can work across different settings. Like you can work in community, you can work in hospital, inpatient. You can also work, sometimes people work from home and they do auditing and other stuff. There's also a lot of emphasis on community nursing. So there are community mental health nurses, district nurses, and people like they can go into education. So there are a wide range of opportunity available if you are working in a mental health setting. Whereas in India, when I was working as a mental health nurse, all I can do is either bedside nursing or community nursing, and there's not much emphasis on community nursing, to be honest. There are no mental health nurses in community I've seen. So there are only 2 services I've seen in India for mental health. One is inpatient and another one is rehab or de-addiction centers, which I have seen, which is the only services available in India. Okay, so the last point for practice is the major difference which I have seen in UK nursing and Indian nursing, mental health nursing, is legal framework. So in UK, yeah, whenever when you're working in a mental health setting, you should know there is a legal framework under which we are working. So people, like patients, they are on sections. They are detained patient, and some of them are voluntary admission, which is informal patients. So mental health nursing is governed by legal framework. So you have sections, and that is under Mental Health Act. So that is the major thing which you need to keep in mind when you are working as a mental health nurse in UK. Whereas in India, there was no legal framework, so it was different across all the regions, and everybody have their own rules. So people were all the patients were voluntarily admitted by either by their next of kin or by their siblings or parents or family members. So they are not abide by, or they are not detained under the any law. But in UK, they are detained under law. So that's the major difference I have seen in UK nursing, mental health nursing, and Indian mental health nursing. Okay, so let's come to clinical skills. So clinical skills are what are the skills you can practice when you're working in inpatient or community as a mental health nurse. What are the things you can practice under law or under your code of conduct? What are the things you can practice? So the first thing, as a mental health nurse, you have to take care of the patient, obviously, but the things you'll be doing on a day-to-day life is, one, you'll be doing medication consists only oral medication, and the injection which you're allowed to give is IM injection, and for that also you have to take a training. So even if you're qualified from India and you were doing all the injection, like for example, I was doing IV procedures, I was doing all other things, blood, CCG, but when I came to UK, I'm not allowed as a mental health nurse to perform all of that. If I would want to do that, I need to take training for that again and then get a certificate, and then I can perform that. So without any training or without any certificate, you cannot perform any procedure here in UK as a nurse, as a mental health nurse specifically. As a mental health nurse, you need to give oral medication, and the only invasive procedure you are allowed to do is IM injection, for which you need to take training. And once you complete your training, then you can perform the IM injection, which is called depot in UK. Another thing which you need to do as a mental health nurse in UK is documenting a lot of documentation. So on an everyday basis, you need to do a lot of assessment, in which we can do mental health assessment, which is MSc, and you can also do risk assessment, mental health assessment, and you can do a care plan for patient. So these are the mandatory thing you need to do. These are not like fictional thing I'm telling you that you need to do for your patient whenever you're getting a new admission. These are mandatory. You need to perform these assessment on your patient. So that means you have a lot of practice to do, like a lot of clinical skill to perform. Whereas I was in India, I was working in a psychiatric setting. All I was allowed is giving medication and talking to patient, and nothing else. I don't remember I was doing anything else other than if a patient got admitted, I needed to do bloods and ECG for that patient, if that needs to be done. Sorry, I just got on my side. So that was the only thing I'm allowed to do. Other than that, I don't think I have done any care planning or any risk assessment or any other mental health assessment on patient, because that was not allowed as a nurse. So that is a plus point. Also, some of the nurses here who have done their non-medical prescriber training, or they have done that course, they can prescribe medication as a mental health nurse as well. So other than that, nurses or mental health nurses also can detain patient under section. So they are allowed to detain patient on 5-4, so which is a nursing section under which you can detain a patient for 6 hours. And so that's one of the skills which you can that's one of the practice you can do as a mental health nurse. Also, you do a lot of training as a mental health nurse, like PMBA, which is physical and violence aggression training. They teach you how to deal with unmanageable patient, or how to manage crisis, which is like you develop your skills. And also, as I've mentioned, that you will be doing a lot of documentation, so that can enhance your soft skills and like IT skills and computer skills as well. And as a mental health nurse, the important thing is you should be having good communication skills, because most of the time when you're doing all these assessment, you'll be talking to your patients, so that require good communication skills. So even if you have like average level of communication skills, you can develop that as a mental health nurse, because on an everyday basis you're going to talk to your patients about their risk, about their care plan and other things. So that can enhance your communication skills as well. And as a mental health nurse, you can go in different settings, and you are not abide by bedside nursing. So you can go in community, you can go in practitioner services, you can become a clinical lead, you can you can work from home, like they are disability assessor who assess disability of the patients working from home. So there are wide range of opportunity in UK as a mental health nurse. And in India, obviously, I used to like the work environment, but there was very less to practice for me as a nurse, and that was just suppressing my clinical skills and my skills as a nurse. So that's why I chose mental health nursing in UK, and that's just my opinion, and everybody have their own opinions why which nursing field they want to prefer. So I was really interested in mental health nursing, so that's why I've chose that. I think I have explained in terms of clinical skills and practice what you can perform and what's the major difference. If you still have any doubt, please leave them down in the comment box below, and I'll make sure that I'll answer that. And also keep watching my videos, and just give me motivation to make more videos. And yeah, that's it for the video. Thanks for watching, and make sure that you subscribe to my channel, because most of the people I've seen that they are watching my video were not subscribing. So you can see that my channel link is here, so please subscribe to my channel.